More than 250,000 people have now died from COVID-19. The human toll has been devastating, particularly in the US. Countries are starting to lift restrictions, keen to ease the pressure on people's mental health and get economies moving again. Those steps, though, are very tentative, with ongoing concern about a possible second wave of infections. Here are today's key developments in our coronavirus coverage. So, new analysis shows the Australian economy is losing $4 billion a week during the shutdown. Treasury estimates the mass closure of businesses will see GDP plunge by 10% in the June quarter, the equivalent of $50 billion being wiped from the economy. National Cabinet is meeting today, with the New Zealand Prime Minister Jacinda Ardern joining the hookup. Leaders will discuss resuming flights across the Tasman in the coming months. The operator of a Western Sydney nursing home has confirmed 3 more staff members have tested positive for COVID-19 as part of a new daily testing regime. 15 residents have died at Newmarch House since the outbreak began last month. Australia has pledged over $350 million towards a global effort to fight COVID-19. An alliance of world leaders is aiming to raise about $12 billion for the Vaccine Research Fund. The US, China and Russia are not taking part. And more than 250,000 people have now died from the virus. The Worldometer website says the global death toll has ticked past 251,000, with nearly 70,000 deaths in the US. Infections now exceed 3.6 million. Now, new figures reveal that keeping coronavirus restrictions in place is costing the Australian economy $4 billion each week. The analysis by the Federal Treasury will be outlined by the Treasurer Josh Frydenberg in a major speech today. While the New Zealand Prime Minister Jacinda Ardern is talking to Australian leaders this morning at their national meeting. Political reporter Dan Conifer joins us now from Canberra. Dan, g'day. So firstly, on the economy, what's expected from the Treasurer when he addresses the National Press Club today?
Well, some stark figures, Joe, including that figure you mentioned there, $4 billion a week, the cost of continuing restrictions in place. Although Josh Frydenberg says that if Australia hadn't got on top of the virus and lockdowns of the type that we've seen in some European countries were in place, that figure could actually be double what we're actually looking at, according to this Treasury analysis. He'll say that in the 3 months to the end of June, so April, May and June, there'll be a $50 billion hit to the economy. That is to say, $50 billion of goods and services that would have been produced just won't be produced because people aren't able to go to their workplaces, businesses that are still operating aren't operating at full capacity, and that households just aren't spending as much as they otherwise would have been. And he'll also turn his attention to employment, specifically the threat of long-term unemployment creeping into the Australian economy in a major way. He'll say that after the 1990s recession, it took 7 years for unemployment rates to revert to their pre-downturn levels, and much of that involved people being out of jobs for years and years, if not permanently, saying that's something that state and territory leaders, when they decide which social restrictions to ease, need to bear in mind.
And Dan, what's on the agenda for today's special National Cabinet video hookup?
Well, Josh Frydenberg's, the numbers produced by Treasury that Josh Frydenberg will outline at the press club, that certainly brings into sharp focus the discussions that the state premiers and territory chief ministers and the Prime Minister will be having about the potential easing of restrictions. They're going to throw around a few of the options in that National Cabinet meeting today. We're not expecting any decisions. We're expecting that those will be made on Friday about a timeline for the easing of various restrictions. But today, they'll be looking at some of the options. I'll be chatting with New Zealand Prime Minister Jacinda Ardern about this idea of a trans-Tasman travel bubble, so quarantine-free travel between our two countries before the borders reopen to the rest of the world. And Scott Morrison will be providing an update to the New Zealand PM about how the COVID Safe app is operating here. New Zealand is looking at implementing something similar over the weeks ahead. And also the premiers and chief ministers will be talking about how workplaces need to prepare for reopening and how businesses can be COVID safe over the months ahead.
Okay, we'll leave it there. Dan Conifer in Canberra. A health company which provides care to elderly residents at Sydney's Newmarch House nursing home is facing allegations of breaches in medical care. Reporter Lara Hyams joins us now from Sydney. Lara, good morning. So what can you tell us about these allegations?
Well, these allegations actually relate to possible breaches in infection control by a staff member of Aspen Medical. Now, Aspen Medical were recruited to assist in the healthcare delivery of Newmarch aged care residents. They were also the one who were contracted to assist in the delivery of healthcare services for those on board the stricken Ruby Princess cruise ship as well, which had been hovering off the south coast of New South Wales. Now, we know at the moment that there have been more than 60 cases of coronavirus at the Newmarch aged care facility. 37 of those have been residents. The remainder have been staff. Now, we don't know the details of these allegations in terms of the breaches, whether that they were possible breaches when it came to the preparation of healthcare, so perhaps in PPE equipment, or if it was in the delivery of the healthcare services. So perhaps a worker coming into face-to-face contact with a resident. Now, this all comes on new revelations today that there have been 3 new cases of coronavirus in New South Wales that have been linked to the staff at the Newmarch facility. Aspen Medical has confirmed to the ABC that they were asked by Anglicare to stand down one of their workers while this investigation was taking place. We have heard from Kerry Chant as well this morning, who is the New South Wales Chief Medical Officer, who has defended some of the workers at the aged care facility. She says that in this particular setting, it can be quite challenging to administer high health care.
Can I just also say that it's really important that we don't blame anyone in this circumstance in terms of the staff infections. We need to look at each of them individually. But some of the stories that have been advised to me is when you're managing or caring for someone who might be confused, you've got masks on, someone reaches out to you and removes your mask. I just like to call out to the aged care workers and the nurses that are working in these facilities and providing care, and accept that it's actually quite challenging to maintain full PPE and interact with the patients.
Kerry Chant there speaking this morning. And Lara, that inquiry into the Ruby Princess cruise ship resumes today. What's expected there?
Well, this is the Special Commission of Inquiry that was announced by the New South Wales Government to investigate who knew what and when in relation to the docking of the Ruby Princess cruise ship in Sydney, where we had those thousands of passengers disembark and effectively pass on some of the coronavirus cases, and that being responsible for that uptake in cases in New South Wales. Today, the inquiry will resume and there will be 5 new witnesses who will take to the stand. One of the people who will be fronting the inquiry is actually a New South Wales health officer by the name of Kellyanne Resler. Now, she was named in the first round, the first set of hearings and details for the inquiry, named by the doctor on board the Ruby Princess cruise ship. And that doctor conceded that she was the one who had a text exchange in relation to a few elements of those on board: the condition of patients, swabs being tested, concerns over passengers that had been travelling from the United States, and there had been some discrepancies over the log recorded of patients who were suffering from flu-like symptoms. So we're expecting Ms. Resler, to be either verifying some of those accounts or challenging as the inquiry takes up today.
OK, Lara Hyams reporting there from Sydney. Turning to Queensland now. So 5 new cases reported this morning, and authorities saying effectively only 2 because 3 of those are Queenslanders who were in other states. So more heartening news from Queensland in terms of limiting the spread of the virus. And while New Zealand is discussing lifting trans-Tasman travel restrictions, the Queensland Premier Anastasia Palaszczuk says Queensland's borders will remain closed for now.
Of course, we've got to take it one step at a time. As Dr. Young always says, you lift some restrictions, you examine it for 2 weeks, and then you can look at lifting further restrictions. And of course, this week, I'll be starting a lot of conversations with heads of the cafes and the restaurant associations. I'll also be speaking with tourism operators as well to put in place our clear roadmap to recovery. It is really important that once we have settled our plan for schools, that now we can focus on our plan for Queensland's economic recovery, including jobs. We'll be speaking with them this week, and what I would be hoping that they would start formulating is COVID-safe plans. So what does it mean in this new COVID world to open up safely? And of course, that's looking at how many patrons they can have in. What we've seen in other countries is outdoor areas opening up first. So of course, we'll be looking at all those measures, and as we put in place our plan for schools, we will have our plan for cafes and restaurants. We'll have our plan for tourism, our recovery roadmap for the future.
World leaders have raised $12.5 billion to help fund the search for a coronavirus vaccine. The efforts have been spearheaded by the European Union. The EU Commission President has praised world leaders for their cooperation. The US was noticeably absent from the conference. But the French President had words of reassurance on that front, as Europe correspondent Linton Besser reports.
Emmanuel Macron effectively said, don't worry, he'll pitch in some coin at some later date. He had a phone call with Donald Trump and was persuaded as a result that, yes, America didn't show up today at this virtual teleconference hosted by Brussels, but they'll play ball at some point. There were 40 countries, a bunch of international organisations and financial institutions that took part today. Australia had a representative there. There was Canada, Saudi Arabia, Japan, Jordan, a whole bunch of world leaders effectively trying to say we're all in it together. This is a global problem and we better fix it. They were aiming for 7.5 billion euro. They fell a touch short, 7.4. But yes, as you say, that's about 12.5 billion Australian dollars, so a fair chunk of coin. Japan gave the biggest donation, 800 million US dollars. Germany and France both gave about they gave 500 million euros. Madonna chucked in €1 million, mind you. And the idea, of course, is to try and find a vaccine, the only thing that is going to return us to any sense of normality, really, as well as trying to identify some treatments that are going to help people that have contracted this disease. And an important point that Ursula von der Leyen made was that when we do find this vaccine, when we do get these treatments, they have to be affordable and they've got to be made available to everyone.
Linton Besser reporting there. The World Health Organization says it's received no evidence or data from the US government to back up claims that the coronavirus originated at a laboratory in China. US President Donald Trump and Secretary of State Mike Pompeo say they've seen evidence, enormous evidence, suggesting that it could be from the Wuhan Institute of Virology lab. WHO Emergencies Chief Dr. Michael Ryan says the evidence and advice that the agency has received suggests the virus is of natural origin.
We have not received any data or specific evidence from the US government relating to the purported origin of the virus. So from our perspective, this remains speculative, but any evidence-based organisation, we would be very willing to receive any information that purports to the origin of the virus, because, as Maria said, the origin of the virus is a very important piece of public health information for future control. So if that data and evidence is available, then it will be for the United States government to decide whether and when it can be shared. But it's difficult for WHO to operate in an information vacuum.
The number of coronavirus infections in Russia has risen to more than 145,000. It's the second day running that the number of cases in the country has exceeded 10,000. Officials are urging the public to stay at home, with lockdown measures extended through to May the 11th. Russia's second largest city, St. Petersburg, has turned off lights at around 500 sites as part of the cost-saving measures to cope with the impact of COVID-19. Turkish President Recep Tayyip Erdogan has announced the easing of some restrictions by the middle of this month. Turkey has had blanket curfews over the last few weekends across 31 cities. Shopping centres and business, including hair salons, will be allowed to open. People over 65 will be now allowed to go out within walking distance of home for a few hours a day, and similar rules will apply to children. President Erdogan has warned that much stricter measures would be put in place if the public does not abide by the rules. The death toll in the country has risen to 3,460.